muscle is tight, it's going to roll the patient's going to have this kind of posture. Okay? And okay, here, this side is high, this is lower, right? Okay, and also you have to see patient hand, distance between the hip from the hand, Looks like this is wider, this is narrow, right? Okay, that means he's a little bit leaning to the left side, right? So all those things that can evaluate the patient, okay? And then you're gonna put the Adam's position, patient's wearing the gown open to the back. Can you slowly tuck your chin? Can you slowly bend down forward? Then you're gonna look at from the back, you have to look at the patient's musculature left to the right, whether it's musculature is evens out. It's pretty even, right? Okay, that's then Adam's position is negative. Thank you. Okay, that's Adam's position. Okay, for next question, active lumbar range of motion. Active lumbar range of motion. Active range of motion, you have to watch the patient's movement. Okay, so which means you have to, you can ask the patient what to do, or you ask the patient to mimic your movement. Okay, your language is short, you have a difficult time with speaking, then you ask the patient to mimic your movement. When they follow your movement, you have to watch the patient's movement though. Okay? So for active lumbar range of motion, can you bend forward to touch the floor slowly, and you watch the patient? Okay? That's the flexion. Okay? Can you back up, stand up? Okay? And can you bend back like that? Okay, and you have to watch the patient's movement. Oh, you're pretty flexible. Well, that's pretty flexible. That's extension. Lateral flexion is, can you your right hand, can you touch the right knee like that? Okay, and the other side. Okay, that's your lateral flexion. Okay, can you go back? Remember, for lateral flexion, there's your left and right. Rotation, there's your left and right. Okay? Remember that. A lot of students forget there's a left and right. So they're going to perform only one side. That means your point is going to get reduced. Okay? For the rotation, can you cross your arm like this? Okay, and can you turn? And the other side? That's the rotation. You have to watch the patient how they move. Okay, that's the active. Okay, for all the range of motion, you have to remember the normal degree. So after you perform this, you have to tell me flexion is 80 degree, extension is 20 to 30 degree, blah blah blah. Okay, but when you say that, you have to use your specific word. Flexion, extension, lateral flexion, and rotation. Okay? Okay? The most students are confused about is lateral, external rotation and internal rotation. There is no lateral rotation. There is no such a thing lateral rotation. There is external rotation and internal rotation. If you use wrong word, that's the reduction of your point. Remember, external rotation, internal rotation. You're going to be a practitioner. You have to, when you talk with a doctor, they're going to pick on you using wrong word. Okay? So you have to remember specific word for a specific thing. External rotation, internal rotation. Okay? Okay. So the hip, for the hip range of motion, you have to provide the patient's stabilization. Can you hold this table like this? And can you turn you have trouble, you can ask the patient to mimic your movement. Hold the table. Okay? And flexion is this. Can you bring your leg up like this? Okay? Okay, to see. Oh. Okay, thank you. That's okay. That's a flexion, 80 to 90 degree. Extension is bring this leg to the back. That's extension. You have to watch the patient's movement. Okay? And the adduction is bring your leg out like that. Okay? And adduction, can you bring your leg like this? Okay? And internal rotation is bring the toe in like this. External rotation bring the toe up. Okay, that's the external rotation. Okay? So that's the hip. Because when you perform this, the patient